we're going to hear now from Dr. Sherino. She is a clinical psychologist, also our MST coordinator, and she's going to speak briefly on sexual assault and how that kind of plays into or can impact the pregnancy experience.
Thanks for the introduction, Dr. Mundy. You can go to the next slide. So I do want to start with a little bit of a trigger warning here. I am going to be talking about sexual violence and how that can have implications on pregnancy, childbirth, and things related to that. So do please take care of yourself, do whatever you need to do to make sure that you are feeling safe during the course of this presentation. Next slide. So first, I want to start by just defining what is sexual violence and sexual trauma. Sexual violence refers to a range of different types of sexual acts that can include contact or non-contact. So when we say contact, we're talking about, I think, what most people tend to think of, which is things like fondling or rape. Whereas non-contact is still related to some kind of violation that is of a sexual nature. So being pressured to perform physical acts, being threatened to perform physical acts, things like that. And this can be something that is committed, meaning the person, the perpetrator follows through with the assault, or it's attempted. Both of those kind of experiences fall under the umbrella of sexual violence. Sexual violence perpetrated against women can occur at any age, so beginning in young childhood. And the reason that that is important in the context of this presentation is that there's actually a lot of research that shows that even a remote history of sexual violence can impact pregnancy outcomes. And so that's kind of why I wanted to start off talking a bit about this today. So in the military, any experience of sexual assault, sexual violence, or threatening sexual harassment is referred to as MST, or military sexual trauma. So throughout the presentation, I'm going to be talking more about sexual violence in general as kind of an umbrella term, in part because even though we know that a lot of our women veterans experience MST, we also know that a lot of our women veterans have experienced sexual trauma even before entering the military. And so a lot of what I'll be discussing today is related to that. Next slide. I mentioned that rates of sexual violence are pretty high. Again, that's part of why I'm here today. I know this is kind of like the downer presentation, and I do apologize for that, but it is so important that you are letting your providers know if you've experienced sexual violence, just because of the large range of impacts that it has. In the United States alone, 43.6% of women experience some type of sexual violence in their lifetime, with 81% of those women having experienced some kind of sexual violence before they're 25. So right, even before they're in those childbearing years and into young adulthood, we're seeing really, really high rates of sexual violence in the community. Among veterans, we see rates of MST up to 1 in 3 women. And in our hospital system alone, that number is closer to 1 in 2. About 46 to 48% of the women veterans that we serve here at Ralph H. Johnson have experienced some kind of sexual violence during their service. There is a large range of mental health difficulties that follow sexual violence. Some of the most common include PTSD, depression, anxiety. Those are the 3 difficulties that we see most often here at VA. We also see more general symptoms of anxiety, as well as substance abuse and suicidal thoughts. But on top of that, people can experience a range of different types of difficulties, including problems communicating or asserting themselves. Again, part of why we're here, we want to make sure you guys know about these resources that are available and know how to advocate for yourselves, because that can be really challenging following an assault. And then difficulties managing emotions and sleep problems are also really common. I'm not going to go too much into that, but I wanted to set the stage because these mental health factors can influence pregnancy. And so there's kind of this relationship where remote sexual assault history impacts mental health, which in turn impacts pregnancy outcomes. So all of this is related. Next slide. Similarly, we see a number of common physical health difficulties following sexual violence. Again, I'm not going to go into too much detail here, but want to highlight the range of impacts that we see among survivors. Today, I'm going to be really just focusing in on reproductive health problems and perinatal issues. Next slide. Okay, so I know there are a lot of words on this slide, but I wanted it to be here for you all to be able to reference back to. Reproductive health problems more generally, we see a lot of menstrual problems and abnormal bleeding among women who've experienced sexual violence, as well as higher rates of infertility. Now, there's not a clear reason as to why this might be, but there is some literature that suggests that sometimes in the context of the violence, if there's any tearing, infection can occur, and that can contribute to some of this. In terms of menstrual problems and abnormal bleeding, sometimes stress can play a role in that. Again, and if you've experienced sexual violence and you're at a greater risk for certain mental health issues like PTSD or anxiety, that can be contributing there as well. We also see higher rates of difficulties like polycystic ovarian syndrome or endometriosis among women with a sexual assault history. Again, the reasons for these linkages is not always clear. We just know that women who've experienced violence are at a higher risk, which means it's more important for us to be making sure that we're doing proper assessment. In terms of difficulties related to pregnancy and childbirth, we see lower infant birth weight, decreased likelihood of making it to full term with a pregnancy, increased likelihood of having postpartum depression or anxiety, as well as increased risks for hospitalization and pregnancy. I apologize in advance. They just started working on the gas lines outside of my house, and my dog pack is about to go bananas. But I will try to keep going over them. We also see higher rates of premature contractions and other difficulties as well. So again, if you are someone who has experienced sexual violence, if you are trying to get pregnant, let your providers know. There are so many ways that even a remote history can have an impact on how we're functioning now. I think so often we get stuck in this pattern of I just need to put it in a box and put it on a shelf and power through, but that doesn't always work. And it still ends up finding a way of presenting in our lives even years later. Next slide. So I mentioned that it's not always clear as to what the link is between these different factors. We do know that negative health behaviors is one of those factors. So things like substance abuse, smoking, difficulty maintaining a healthy body weight, and risky sexual behaviors. All of those factors can contribute to these difficulties with pregnancy and fertility. And again, when thinking about these relationships, we know that women who experience a history of sexual trauma are more likely to engage in some of these negative health behaviors, in part because it's a way of coping with the trauma that they experience. So again, let your mental health providers know there are services that are available. And here is just a diagram that really highlights some of the ways in which these different factors relate to one another. This is taken from an article. I did not create this diagram, but did really think that it provided a good representation. So if you see sexual trauma at the top, you can see how it impacts mental health, physical health, and these negative health behaviors, creating this indirect relationship between sexual trauma and pregnancy outcomes. And so if you are experiencing difficulties in any of these areas related to mental health, physical health, negative health behaviors, a combination of all three, all of that is going to compound your risk for having difficulties related to your pregnancy. Next slide. So what do we do here at VA? So there are a few different ways in which we work to help survivors. The first is universal screening procedures. So here at VA, we screen explicitly for military sexual trauma. We also screen for domestic violence, which can include marital rape or sexual abuse within the context of an intimate partner relationship. Outside of that, in terms of childhood sexual abuse experiences, that's something that is not explicitly screened for. And so that is something that may be asked during initial intake evaluation, but is not necessarily something that is going to be asked in a primary care setting, for example. On top of that, for survivors who've experienced military sexual trauma, we do offer free mental health and physical health services for any difficulties related to MST. And that would include any reproductive health care. If in your provider's opinion, the difficulties that you're having started or got worse after experiencing sexual violence in the military, then that would be covered to you. So let's say you were assaulted, you contracted an STI that resulted in infertility. Your treatment related to that would be covered. VA also has an MST coordinator available at every facility. I'm our coordinator here. One of our primary roles is to do things like this, to help give education, to help educate staff, to make sure you're all getting the best care, and to help get you connected for services. And so if you have experienced MST and have questions about getting connected to mental health, do feel free to reach out. The last thing I'll mention here is that we have a range of different mental health services available that specifically address some of those root issues. So difficulties related to some of those mental health problems like PTSD. We work to address some of those negative health behaviors like smoking cessation, substance abuse related issues. And so there are a range of services that can help to improve your perinatal outcomes. Next slide. And that is all I have for you all today. Thank you so much.
Thank you. And no problem about the dog, such as life, right? He's not very happy right now.